Welcome to Oncology Data Advisor. Today I have the honor of being joined by Dr. Margaret Barton-Burke, who is the Director of Nursing Research at Memorial Sloan Kettering Cancer Center. At the Oncology Nursing Society Congress in April, Dr. Barton-Burke received the ONS Lifetime Achievement Award, which recognizes a member's exceptional contributions, dedications, and impacts in oncology nursing throughout their career. Dr. Barton-Burke, it's a pleasure to have you on the show today.
It's a pleasure to be here, Kira. I am excited. Sorry we couldn't meet at ONS Congress, but it was a very busy time for all of us. So I appreciate that we set up this podcast and we can actually have conversation. Looking forward to spending some time with you.
Yes, me too. To start off the talk, would you like to introduce yourself and share a little bit about what you do?
Absolutely. So my name, again, Margaret Barton-Burke. That's how I usually start off every introduction. So um, I also start off with the fact that I'm an oncology nurse. Yes, I have a PhD. Yes, I run research at Memorial Sloan Kettering Cancer Center for nurses. Um, but I really do think of myself as a nurse, and so been a nurse for quite a while, and have been in the Oncology Nursing Society for since probably the mid 1980s. It was probably one of the best things that ever happened to me, but I'll tell you more about that later. Um, I was a first generation individual out of my family to go to college. I was also, I got a master's degree in Boston at Boston University in the area of clinical specialty and education for nurses. And then later in my career, I decided to go for a PhD. Uh, some of that rigor or changes in education have changed over time, and I probably would have gone for a PhD quicker or sooner. But my path was sort of carved out probably by coincidence, and also by the work that I've done in my life. A little bit more about me. So I have only ever worked in oncology. I actually worked critical care before oncology, but that was like for the first couple of years of my clinical work. I would also say that also brought me to oncology because I was hired into Dana-Farber as their head of education. Um, when they were starting bone marrow transplants, and we really thought we had to gear up and really treat our bone marrow transplant patients as critical care patients. And so we needed to train up a lot of staff. And then we did on all the aspects of ICU, intensive care. Um, but from there, I've actually taught oncology in academic settings. I've taught oncology in schools of nursing. I have then worked as a clinical specialist, especially after I got my PhD. PhD takes such a long time to accomplish. I didn't even know whether I really liked patients at the end of all this, and decided to go back to clinical specialty work with cancer patients, and I positively love the work. But I also found out after I had done all the work with my PhD, I wasn't doing research, I was doing more clinical practice. So I said I really needed to go to academia. And I went to the University of Massachusetts Amherst in their School of Nursing. And from there, I went to University of Missouri as an endowed professor in oncology nursing, where I actually got to do a great amount of work, and this will be the basis for some of the research that I've done. And then from University of Missouri, I actually went to Memorial Sloan Kettering. So very, very, very busy, busy times.
Absolutely. Awesome. Thanks so much for telling us about your work and how your career has evolved throughout the years. All of which was encompassed in the ONS Lifetime Achievement Award, which you just won at ONS this year. So congratulations again. How does it feel to have received the award?
Uh, I have to say that I am humbled and I'm overwhelmed. And the reason I say that is because as when I gave my awards speech, I said I really never won anything before. I really was never even named before in a number of different things. Didn't win any awards, except I said a frozen turkey one time. And that was a long time ago. And so when somebody from Memorial Sloan Kettering said to me, we're going to put you in for Lifetime Achievement Award, I thought, oh yeah, sure. Okay, fine. But I would never win that award. Um, and I did not realize what went on behind the scenes because I'm a very high control person and really like to know what's going on. But in this area, I really didn't pay attention to the letters that were written or anything. They said, we just need a CV from you. Okay, I updated my CV and put it all together. Sent it on to the person who was submitting, but also found out later on that my chief nursing officer, or she's a CNE, chief nursing executive, um, was given wrote a letter. There also another one of my colleagues from my department wrote a letter along with that initial person who said, we're going to submit you for lifetime achievement. So I didn't realize all that was going on behind the scenes with regard to that. I felt like there were so many things that happened, but when I finally did get the award and get the notice, it was exciting, very exciting. And it was exciting not just for me, but for my family. Um, my whole family came to the award ceremony, and I'm talking about my brother-in-law, who was representing my sister who died a couple of years ago. I think we all were like, whoa, this is really important. So yes. And then when I got to ONS and I gave the speech and afterwards, the excitement, not just from my colleagues at Memorial Sloan Kettering, but from all the people that over my career who I've touched or worked with or had contact with, both on the internet through LinkedIn, but also just emails. And the house had tons of flowers from people sending, just it was big. It was a big deal. Much more so again than, like I said, when they first started to submit my name. Yeah, sure, it's going to happen.
Right.
So it was a big deal. Yeah.
It's really exciting. I'm sure it was a very surreal experience too.
It was, that's exactly. It was, like I said, overwhelmed, humbled, because I just do the work that I do. I don't do it for an award or for my name being put forward. And then surreal is actually the best word.
Yeah, I was at the award ceremony as well, and it was awesome just to hear your speech and all the other honorees there. It was just really inspiring just to see how much amazing work has been done in this organization.
Yeah, and the organization is a wonderful. So I was president of ONS in 2014 to 2016. And I think the interesting thing is that I call it the ONS career ladder as well. I've been volunteering at ONS in a variety of ways since probably that mid 1980 timeframe. I was on certain kinds of committees as corresponding members. You didn't do a lot of work, but you got connected with the organization. I enjoyed and was actually very involved with my local chapter in Boston. At the time, I became Boston's chapter president. And I think it's really important to realize that, from there, and also the work you're doing at the national level, I had also chaired the Congress that happened in 1992 or three, something like that. And the reason I say that is because after something like that, in such a leadership position, they expect you to move on to the board and then on to president if that's what you want to do. And I really felt like I had done my work chairing the conference, but in the 1990s, I was in my doctoral program, and I really felt like I needed to spend my time finishing my doctorate, getting that sort of done. So I didn't step away from ONS, but I wasn't as active in ONS. And again, I think sometimes people fear that kind of a step will take you away from sort of the face fronting work that many people do. But again, I just did what I could do. I was involved in a lot of some of the research initiatives that were happening within ONS, state of the science articles, state of the science. We actually did an initial state of the science research project on fatigue in the 1990s. All of this was happening in the 1990s. So by stepping away from many of the ONS work, I actually had an opportunity to, just get my personal work done, I guess, or my personal professional work done. Meanwhile, in I guess the year around 2008 or so, I was recruited to St. Louis, Missouri, and somebody had reached out to me because I had done a fellowship one summer. I was at UMass Amherst and I did a fellowship one summer at Mass General, and it was for faculty and students to do an oncology fellowship. It was a great summer. I absolutely loved the whole summer. But from there, that's what also brought me to Missouri, because they were like, no, you've been oncology. We need somebody who's oncology. But some of the contacts from Mass General actually was a contact from Mass General called me and said, would you be interested in running for the board? That was the time in my career to say, yeah, I could run for the board. Didn't think that, again, there's a fair amount of competition, got on the board, not only got voted in, but got on the board. And the board term is 3 years. So after 3 years, what I did was I actually, during my 3rd year, I looked around and said, looking at what the president's doing, maybe I should run for president, or at time it was you run for vice president and then you become president. I said, maybe I should do that. And there was a colleague who was sort of a leader as well. And I said, are you going to run for president? She said, no. I said, then I think I'm going to throw my name in the hat. Interestingly, usually president elections are 2 people. Well, they had 3 people running. So that really, again, when you think about being humbled by different activities, I really had a third of a chance, not a 50% chance, 33 and a third. That's not a great chance to win an election, but I won it. And so I became vice president and then president. And I will say that being president of ONS was probably one of the best experiences of my life. When people had asked, you traveled, you networked, you spent time with people, not just in the US, but around the world. And so it was a great opportunity. And I'm really glad that I did it at the time in my career when I could actually give myself to the job and not feel pulled in a lot of different directions.
Absolutely. I'm sure that was such an incredible experience that led to many opportunities and a lot of impact in the nursing community.
Exactly. And the interesting thing is that way back when we published in 1991 our first book, and it was really the first book, and it wasn't through ONS, it was actually just through a publisher in Boston on oncology, on cancer chemotherapy. And it was myself, a colleague, and 3 other colleagues. When I said that I saw people that I had touched for years gone by, one of our early authors from that book came up to me after the award ceremony. And it was one of those things, I haven't seen her in probably 20 years. But to realize that we had connected way back when in the 1990s to now was really significant. And so it was amazing. And we also, I mean, the fact that we did this book, one book for several years, and then we actually morphed it into a very large book that went on till 2021, when the publisher finally said there's not being enough books published because everything's gone electronic, to sell, so, and by that time we were all okay with, we'll do whatever, but we had made our mark in the 1990s.
That's really amazing. That leads right into one of my next questions as well, which is what are some of the things that your research has focused on throughout your career, both initiatives through ONS as well as individually, and books you've written? I'd love to hear more about it.
So as the director of nursing research at Dana-Farber, came to realize, and as involved in the chemotherapy, in the ONS chapter of Boston, I actually remember that we really didn't have good books or even information. There was lots of information about chemotherapy at the time, but it was in articles, it was in physicians' books, it was sort of spread around. And a small group of us got together and said something like, what would happen if we put our heads together and we came up with a book? And we actually came up with a book that was award-winning. The ANA gave us an award on the book, the first book that we wrote. partly because I think that that book was, the first of its kind pretty much in cancer chemotherapy. From that time on, ONS then adopted a different book and so on and so forth. And they also had another, like an essentials book on cancer chemotherapy that morphed into biotherapy. But I mean, we took the first step, and it was a small group of bachelor's and master's prepared nurses who looked at each other and said, we're gonna write a book. Now, we knew nothing about writing a book. Um, and one person said, but who are we to write the book? I said, if we don't write it, somebody else will write it. So why don't we write it? Like, let's give it a shot. I learned a lot about working on a computer. I mean, again, keep in mind when we were writing this book, it was in the late 1980s, and although it's 2024 now, at that time, we all didn't have the skills that we have now for saving and then building. So the interesting thing was, so we did the book, but from there, when I got into even my master's work and my PhD work, really was on what I would call, we now call it symptom science, but it was really on, and I call my work survivorship, but I didn't at the time. I was involved a lot in symptom science. So I was involved in pain, sexual health of women, particularly after cancer, after chemotherapy, particularly, and then also fatigue. And we became very involved in fatigue because we knew that patients had this fatigue, but we didn't understand what was going on with the fatigue. Now, those three were the main symptoms that I really focused on and had worked in different areas in my career. When I say symptom science, it is bigger than that. Fatigue morphed into sleep and sleep habits, and pain expanded from just chronic pain to immediate pain, but also now with all the problems that we saw in the literature and on the news about people being overdosed. And but we were way at the head of that, that work. And the final thing was, my master's paper was in sexual health and sexuality and cancer. So just again, being aware of some of that. As I looked at those three symptoms, and also that I had a dean once query me, and she said, none of your work goes together. And I left that interview thinking, I don't have that job. As I drove home, I started saying, no, my work has always really been in survivorship. What happens after a patient finishes treatment, is quote unquote cured, or can live their lives and the quality of their lives, but they have all these other symptoms that are left over. So again, my dissertation was really in survivorship, but we didn't call, the word was not around at the time. So I just called it experiences of women with cancer, experiences of women with breast cancer after their years after their diagnosis. That's how I called survivorship at the time. It was a great study. It was a study of 7 women, but we did focus focus groups, but we did 6 focus groups with the same 7 women over 6 weeks. So it was serial focus groups by the time we were done. And what we really learned was how there's an impact on all different areas of their life. So physical, psychological, spiritual and existential, economic, as well as social. So it was a great study. It was a lot of work, but I really enjoyed doing it, and it has been the work that I have continued to do. So when I went to St. Louis, I had a funded study on Black women breast cancer survivors because I felt like my group for dissertation was all white women. And although one of the members of my committee said, so when you write your book, I said, I don't have the full picture. I only had a white picture of what that experience was like. I wanted to really do this comparable study with Black women, Hispanic women, and Asian women. and I got to Black women, and I stayed there for several years, exploring, doing a similar study, but then taking that work and actually making what I would call evidence-based products from the work that we did. And that was all in St. Louis, and it was so well received. And probably I would have stayed in St. Louis longer had not this opportunity at Memorial Sloan Kettering come along. But what I do at Memorial is I do some of my own research, and it's still related to breast cancer. And we just did some technology study, looking at mobile phones and the use of an app, that kind of thing, to keep patients on their treatment course. But I also spend a lot of time. We have 5,000 nurses, spend a lot of time being a research consultant,
Mhm.
helping people create their research. I was also just on a call this morning about that. Creating a solid study, a study that is not what I would call loosey-goosey, but is tight and controlled, and that they can actually take for funding or other opportunities. So that's where my work has moved to. The interesting thing is in 2024, I have a Fulbright fellowship, and it will be on research capacity building, which is essentially what I've been doing at Memorial. And I've done some of this in Nigeria and Kenya, but now I'm going to go on a Fulbright to Ireland for 4 months in 2025, probably.
That's
So
really
yeah,
incredible.
yeah. So life is not over after an award, a
Right.
Lifetime Achievement Award.
Yes. It's so interesting to hear, since survivorship is such a key word in oncology right now. It's fascinating to hear about, where it started and all the research that has gone into improving survivorship for cancer patients.
I appreciate you saying that because, again, for the longest time, I always considered cancer as a chronic disease and not a one time, because I just saw patients coming back or patients asking questions that really said that this goes on well beyond when you have the disease, or even after the disease. And then we moved our thinking from an acute disease to a more chronic disease, and then survivorship. So it's been nice to watch, really, the growth of cancer treatment, cancer knowledge. I mean, because I love the science part of oncology. It always keeps me interesting.
Absolutely. And I look forward to hearing more about the work with the Fulbright as well. It's very exciting.
I know. I'll start that after I go on vacation next week.
Yes. Vacation is always important.
Exactly. But I have to write IRB proposals for
Right.
Ireland and for MSK. So yeah.
Yeah.
And I will still during the Fulbright, I will still have this role
Mhm.
in most capacities. I mean, I may not be able to do face-to-face meetings. They might be call-in meetings, or Zoom meetings for me. But I'll still be doing the role as well. So it's exciting.
Very exciting. So, with all of this work that you've done throughout your career and are continuing to do, what have you found most rewarding about being an oncology nurse researcher?
What I love the science
Mhm.
of I love the science of cancer. I have always loved to understand what's happening in the cells, and how radiation, surgery, and or chemotherapy, now immunotherapy, all affect those cells. So I love the cellular work that has gone on and the cellular knowledge that we have gained. I think it's also surpassed me at times when I sit and talk with some of the current clinical specialists, and I say something about immunotherapy, but Margaret, we don't know this till we know that. And I'm like, wow, like I love it, but it's really going really fast. That knowledge is really going really fast. And when I sit at certain meetings at MSK, and they're talking about the biological markers that we're learning about all the time. To me, again, all of this is interesting, fascinating, and I really truly believe that that's what keeps me involved in cancer. Now, as a nurse researcher, what nurse researchers really do is they really focus on responses to illness. And that's what nurses really do as well. We respond to the symptoms, the side effects, the problems that patients have, both clinically, psychologically, et cetera. And so the research that I've done and conducted has really been built in terms of responses. So for example, when I did the study of a replication study of my dissertation, and I worked with Black women breast cancer survivors, I did that in Boston. I did it with a group in Dallas and Arlington, Texas. And then when I went to St. Louis, we continued that work. What I found was the kind of information that they were sharing was similar but very different. And the difference in the I guess the responses that I was getting really aligned with the social determinants of health. And that one woman called the fact that she had really gotten herself out of off of any kind of help, assistance, in any way, shape, or form. She had a job. And then she got diagnosed with breast cancer. And by getting diagnosed with breast cancer, and maybe her insurance, I don't know what her insurance was, but with the insurance, the impact of her insurance and also the treatments, what she found is that she had to use her credit card more and more and more to survive, all, maybe not going to work, or maybe having to buy more food than, you know, outside food than really cooking her own food or whatever. But she used her credit card more because of her illness. And she called it almost like an enslavement back into where she had come from. And she was feeling very regretful of that, of what cancer had done to her, and I don't think it was that she was, because a lot of people talk about cancer and thriving. I felt like she really felt like because she had bought a house or a condo, and really was feeling very successful. And I think cancer really set her back, emotionally as well as economically. So it was that kind of information that I learned from a variety of women that we interviewed. And actually, one woman down in Texas said to me, Dr. Margaret, I don't even know why we're telling you what we're telling you. We don't even tell our families some of the stuff we're telling you. But I think there was opportunity for them to trust me
Mhm.
as an individual, but then also share these thoughts and ideas, because they were important to be shared, and individuals didn't have a place to share those thoughts. But from that, we developed a Knowledge is Power conference at the University of Missouri St. Louis. And what we really did was every year, right after Breast Cancer Awareness Month, because everybody was so busy with that month, the first Saturday in November, we always had the Knowledge is Power conference. We had It was for the community of color in St. Louis. We had only presenters that were of color, and that was not always easy to find because I'm a white person, but we had a mixed race group of people planning the conference. And so that people who were presenting to their to the audience could speak the language that was worthwhile to the audience, not to Margaret, not to another person just trying to check off a continuing ed box, if you know what I'm saying. So it was every year it was 300. We could only take 300 people, and every year it was sold out. And by sold out is that I found all grant money to run it. We ran it for free. Um, so everybody from the community year after year would say, are you going to do the next conference? Are you going to do the next conference? They also told us how to change the food selections that we initially made to make them again appropriate for the population that we were serving. And it really became, we did it for 6 years, and it was an amazing event, absolutely amazing event. And when I left, nobody sustained it, which is sad. But the reality is that, maybe some things just die when they need to die, or close when they need to close. But it was really pretty successful.
That's really amazing.
Mm, it really was.
Mhm.
I love doing that work.
Mhm.
I had a I guess she was called a program coordinator, and she was from St. Louis community because I was not. But she, in so many ways, her name was Ebony Smith. She helped me in so many ways. She was a master's in public health student, and really helped me be acknowledged, I guess, by the community, But then after a while, the community got to know Dr. Margaret at it was called UMSL, University of Missouri, St. Louis. Dr. Margaret at University of Missouri, St. Louis. The other interesting thing is that they would also ask Ebony and then me questions that they really had for their physicians or their their healthcare provider, but were not comfortable asking. So why do I have to take tamoxifen? Why do I have to take tamoxifen for so many days? I have the pills in my medicine chest, but I'm not taking them yet because I don't understand it. So we got to do more with the community than we ever expected, I think, while we were doing our study, so
Right. That's wonderful.
yeah, it was great. It was really great.
Mhm. So the last question I have for you has to do with the theme of ONS this year, which is Ignite the Extraordinary. So how do you personally fuel your own motivation as an oncology nurse? And in turn, how do you help to spark that passion within the nursing community?
I Ignite the Extraordinary to me um, felt very much like when I was chair of ONS way back when. And because we did something, the conference was going to be in Orlando, and we did something related to magic, and again, it was the same kind of,
Mhm.
this is a time when you can actually do something wonderfully magical, so when I saw the Ignite the Extraordinary, I thought the same thing. Now, I don't think of myself as an extraordinary person. I just think of as I said, myself as a nurse who has just done some, I guess, good things, over the course of my life and my professional career. But I think whatever I am involved in, is very exciting, and I bring an excitement to, let's try this. Let's try this opportunity. Let's innovate here. Let's think about something different. I like to do that, but not fall off a cliff with crazy ideas. It's things that I think are accomplishable. I was even on again an earlier call where we're doing something in early 2025, but I said, but for me, I'm just a little turtle, and we got to start now so that I know I can get it accomplished. But if we go to wait till September, everything's going to be crashed in. And I know I like to think about every single step that I'm doing, but I don't want it to impede other people's progress as well. What I love about Excite the Extraordinary is the fact that I have been able to excite the extraordinary, I think, in individuals that I have worked with. I am talking about nurses. Um, I have physician colleagues that invite me to certain committees because I think that I have a good idea or a good head on my shoulders, and that I can think through things. Um, the wonderful thing about working with ONS and being their president was to actually be able to share other like ideas with as 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 the staff brought ideas to the board, we then were able to sort of unpackage those ideas, accept them as is, or suggest a different way of approaching those ideas, but always, always being able to have a reachable outcome. Everybody talks about outcomes, but I don't think I think sometimes some people reach too far. I try to reach for beyond the low hanging fruit, maybe mid hanging fruit. I don't always get to the top till later, but I really do think that excite the extraordinary to me was a great way for me to, number one, be named, but also to be able to tell more people about ONS. And I've always told more people about ONS. I think sometimes we in nursing talk to each other. I think the important thing for all of us is to like sort of turn around and talk to people who don't know about ONS. They don't realize that ONS has the largest membership of all specialty organizations, um, including the big physician um, group of ASCO. Member wise, we have always consistently had a larger membership. They have a lot more people going to their conference, but
Mhm.
if we're going to get down to nuts and bolts, we've been very successful at keeping our membership at a certain level for a very long time. And we've also invited students in, again, to think about ways to engage the beginner people. I'm not talking about age-wise, I'm talking about people who are beginning in nursing, and some of those are not young people, um, but have them start to work with us in oncology in a different way, and as students, that's where the work is now heading at MSK even, because we are starting to look at junior nursing students or senior nursing students introducing oncology courses. We're going to have five nurses, no, five student nurses working with five researchers this summer at MSK from a university in the area. So we are expanding, growing, igniting ideas. And we also have an innovation path that we're starting to create at MSK. So we have a lot of different things. Where does this all come from? I don't know, like in terms of my head, but I do think it's great to put a lot of good people together and you come up with a research path, an innovation path, a student path. We're starting to offer all of those paths to
Mhm.
nurses so that they can help find their way.
Definitely. And I really like the word ignite in the theme. So that implies taking that first step, just creating the spark that'll, create a ripple effect and help all this amazing research to go forward.
Correct. And I love the idea of lighting that fire, striking that match.
Yep, absolutely. Well, this has been so wonderful talking with you today and hearing all about your research and ongoing research directions you have. It's really wonderful to hear about all this impact that has been made in the nursing community. So thank you again for stopping by to talk with us today.
Well, Kira, thank you so much for, you know, like I said, following up after ONS and connecting with me, because this has been a great opportunity for me to share not just my ideas, but also to share the wealth of knowledge and experience that I have learned by
Mhm.
working with ONS. And I think that that's important for people to understand, that ONS gives they ask for volunteers, but they also give
Mhm.
you a lot. They support you a lot. So
Absolutely. Great. So thank you again.